Hi, okay, so I have patient number 3. She's a female, age 52. Screencast wasn't working, so I'm recording it like this. Here we go. So, medical history of the patient. Her parents have had issues with diabetes. Both are overweight. Her grandfather on both sides have had strokes previously, and both have been put on warfarin. So this can tell us that there have been some hereditary issues and that the patient might have inherited some genes that could lead to cardiovascular diseases or more dangerous conditions. And as she's an avid smoker, which means that she already has health issues in addition to her passed down genes. She's white British, and she previously went on a 17-hour flight before experiencing symptoms, which are shortness of breath, pain in the chest, coughing up blood, which tells us that the issue might be in the lungs. Left leg was also red and swollen, with some vessels showing on the surface. This can also tell us that the problem would be in the veins or the blood and near the legs. Tests that can be used, we could use blood tests, MRIs, and X-rays. They might not be fully sufficient because if we're looking for blood clots, they might not show on MRIs because blood clots can hide very well. If we are looking for blood clots, then we can use specific tests to look for blood clots. This is the normal heart and the electrical activity. In the normal heart, the veins help blood flow through the body constantly to make sure that all parts of the body are receiving the right amount of oxygen and nutrients needed. A healthy person should refrain from smoking or having bad dietary habits in order to prevent the risk of blood clots, especially in older patients because their heart is weaker. Blood flows from the heart to all of the body through the arteries. The blood travels from the heart to the lungs through the pulmonary tract. It consists of 2 periods, one where the heart muscle relaxes and refills with blood, which is called diastole, and the second is a period of robust contraction and then pumping of the blood. So our heart's electrical system controls the timing of our heartbeat by sending an electrical signal through cells. Now to the diagnostic of my patient. I predicted that she had pulmonary embolism, or more specifically, deep vein thrombosis. The symptoms of these conditions and her symptoms align perfectly because it's shortness of breath, chest pain, cough, rapid or irregular heartbeat, and leg pain or swelling. So, pulmonary embolism. Around 600,000 people per year get pulmonary embolism, which can lead to around 350,000 deaths per year. The blood clots in pulmonary embolism are very good at hiding, which can lead to incorrect results during testing, which I mentioned about the X-rays. Pulmonary embolism is an umbrella term for many blood clot conditions, and one of them is more specifically deep vein thrombosis, or DVT. Deep veins are located in the muscles, in our case the leg muscles, and have an important task of transporting blood back to the heart with the assistance of both vein valves and muscle contractions. Valves are found throughout the veins, especially in the legs, and help push the blood from periphery of the body through the veins towards the heart. Hence, valves prevent backward blood flow away from the heart. The blood clot fills the interior of the vein, obstructing the blood flow and causing several complications. As we can see here, this is the valve, and this is the blood clot that's filling it up and making the complications. Circulating clotting factors arise with age, as I've mentioned, and she's 52, so it would make sense. Any blood clot in a vein is eventually going to end its way into the right atrium of the heart, as we can see here, the heart, and it pumps the clot into the pulmonary arteries. And because the pulmonary artery gets smaller, the blood clot will get caught in the lungs. The patient's cause of pain in her legs is most likely due to the blood clot that has formed. It could be from her 17-hour flight, which she didn't move her legs a lot. Also, when having surgery, that could also lead to these type of pains. Deep vein thrombosis can develop if you have certain medical conditions that can affect how your blood clots. Also, if you don't move for a long period of time. Blood clots in your veins can break loose, travel through the bloodstream, and lodge in your lungs, blocking blood flow. and that is what pulmonary embolism is called. Because the blood flow typically goes to the lower part of the lungs due to the gravity, more or less, there will be signs of pulmonary embolism on the bottom of the lung, which we can see here on the x-ray. When there is a blood clot in the lung, there can no longer be perfusion to that area of the lung, which is called ventilation without perfusion. There is extra blood that should have gone to the area, but it has to move to other areas of the lung. This causes an increased flow of blood to the other areas of the lung, and it's called VQ mismatch. This could also be the cause of how she was coughing up blood. Pulmonary embolisms usually are not removed because the body eventually reabsorbs the clot over time. Some people fully recover, others do not. For most patients, the recommendation is that they go on some form of blood thinner medication for at least 3 to 6 months. A DVT, or deep vein thrombosis, or pulmonary embolism can take weeks or months to totally dissolve. Even a surface clot, which is a very minor issue, can take weeks to go away. So as explained here, the lungs are shorter, and that is because of the blood clot stopping the lungs from getting all the blood that they need. So risk factors and treatments, as I mentioned, blood thinners, medication is really good, which helps the blood's ability to clot or decreases it. And also surgery could be a suggestion just to take out the blood clot, but that could be a bit risky. And also if you've already had surgery, then that also might be a cause for blood clots. Obesity is also a big factor, and women that are older than 30 and are avid smokers, as mentioned here, are a big risk factor for pulmonary embolism or deep vein thrombosis. These are my sources. Thank you.